everyone, Dr. Jade Rainbolt here, physical therapist, and today I'm going to go over one vital cue that you need to do to improve your stretches. So this one little tiny thing is going to make the world of a difference with how well you feel these stretches. And I feel like until I was 18, 19 years old, I had no clue about this. I was just going through these stretches and not knowing what I was doing, why I wasn't feeling it. But this one little cue fixed that. So I'm gonna go over 3 stretches that are commonly misperformed and how you can improve them. So the first one is gonna be a hamstring stretch. So you'll see people doing hamstring stretches like this, you know, bending all the way to the ground. You think, wow, they can go all the way to the ground? That is so impressive. But look at this round in my back. That is what we don't want. So the one little move that we are gonna go over is called a pelvic tilt. So having control over your pelvis is going to help you immensely, not only for stretching, but for exercises, for weightlifting, for movements in your daily life. It is a huge, huge benefit to know how to move your pelvis. So what we're gonna go over is the pelvic tilt. So an anterior pelvic tilt is whenever the pelvis is tilted anteriorly. If you think of this as the front of the pelvis and then the back. So think of arching your back and sticking your butt out. And then if you're going to posteriorly pelvic tilt, you're going to think about looking at, like you had a belt buckle on, like you're looking at your belt buckle. So you're tucking your tailbone in. So anterior pelvic tilt, posterior. So it's kind of like, okay, so it's kind of like twerking, I guess. Yeah, but it's anterior, posterior. So doing this simple little tiny movement, again, anterior, think about arching your back, sticking your butt out. Posterior, you're looking at your belt buckle, belly button. But simply practicing this first is very beneficial. But as you do these stretches, think about going into an anterior pelvic tilt and then leaning forward. And guys, I already feel it here. You don't have to go near as far. So, or you could round forward and go like that, and that's gonna just put a ton of strain on your back. And the purpose of exercising is to prevent injury, get stronger. And if you're rounding your back like that, it's not putting tension. So the hamstring hooks on to your ischial tuberosity. So by anteriorly pelvic tilting, you're pulling that hamstring back, lengthening it. So you don't have to go as far to feel that pull. You're not having to strain your low back to get that pull. So making sure you're tilted back and then leaning forward, and then you get that nice hamstring stretch. Otherwise, if you're not tilted, you go real far forward, you get that terrible bend in your back, and that can cause pain. You're not gonna get as good of a stretch, and it's just not as good. When you're doing stretches, you also wanna hold them for 30 seconds. So the muscles are tissues. The tissue needs 30 seconds for them to actually elongate. And if you do it less than 30 seconds, they're gonna go right back to how they were, and it's not gonna be as effective. So that is number 1. Number 2 is gonna be a hip flexor stretch. So you guys may see people going like this, you know, bending real far, trying to get that hip flexor. But if we use this pelvic tilt cue that we just learned, think about this time you're going to posteriorly pelvic tilt. So the hip flexor runs from the leg, comes through to the front. So you're going to posteriorly pelvic tilt, and this in turn puts the muscle on stretch. And then even right here, I already feel it. You don't have to do any of this crazy bending. So less is more. Good form, less is more. You don't want to bend like crazy, arch your back, and have this weird, you know, like circus movement that you're doing to get this stretch. Simply keep that leg back, pelvic tilt, and if you want a little bit more, you can bend that front leg. But you want to keep these nice and controlled because you want to do good. You don't want to do more harm. And then again, holding that for 30 seconds. So that is number 2. And the third one is going to be a quad stretch. So a lot of times you'll see people going like this, or their leg will be up here thinking you're doing a quad stretch in the front. You know, their leg may be way back here. But if we go back to that pelvic tilt that we just learned, again, you can hold on to something for balance. This isn't a balance exercise, but you're going to posteriorly pelvic tilt. So this thigh muscle, your quad, hooks on to the front of your pelvis. So you're going to tighten that muscle simply just by pelvic tilting posteriorly. And then you can either go and then grab your foot, or you can grab your foot and then tilt. So you're here, pelvic tilt, and you want to think of your knee facing down towards the ground. So you don't want it to flare way out here, sort of like that. You don't want it to come way forward. You want it pointed towards the ground, next to your other knee, and then pelvic tilt. And guys, that is gonna make it so much stronger and better. And again, you don't have to do some circus acrobat movement to get this stretch. Nice hold for 30 seconds, and then relax. So if there's one thing you take out of this, learn how to control your pelvis, practice your anterior, posterior pelvic tilt. This will help immensely. Hold your stretches for 30 seconds. And if you guys found this video helpful, make sure to give it a like, and I will see you in the next video.